Millions of Americans have low vision and cannot correct their eyesight with regular glasses, contact lenses, medicine, or surgery. Low vision can result from a variety of eye diseases and health conditions. Age-related macular degeneration accounts for almost 45% of all cases. Many people with cataract, glaucoma, or diabetic retinopathy also have low vision.
In the past, low vision was defined as vision 20/70 or less. The definition now is vision loss not correctable with standard glasses or contact lenses that affects the person's functional abilities. So it's not about a number now, it's about reduced vision that's affecting the quality of life of the individual and their functional abilities. To get a referral to a specialist in low vision, you should really start with your regular eye care provider. So ask them who they would like to refer you to. Ultimately, you have to get an evaluation because an evaluation is going to sort out what things are going to help you to function better. You're going to have a chance to actually try those devices.
So this lecture is about low vision and some of the conditions, typically age-related conditions, that are associated with low vision. So just to start, as I mentioned, low vision conditions most commonly will affect those later in life, where 80% of those with low vision are actually over the age of 65. Now, the number of people living with low vision is actually increasing. Of course, with the population demographics as they are right now, we have an increasing number of people that are getting into those later stages of life. And so that's one of the reasons why we're seeing an increase in low vision prevalence. But another reason also actually has to do with the depletion of the ozone layer, which is increasing the amount of ultraviolet radiation that's getting to the Earth's surface. And as we'll discuss, ultraviolet radiation can actually contribute to some of these age-related conditions. Now, low vision has a number of functional implications, the first of which is that it can certainly impede on a person's independence. We use vision for so many things in our daily life that when that actually starts to be affected, the way that we are able to go about daily occupations changes, and it can get to the point where we can no longer do them independently. As well, with low vision conditions, individuals are at an increased risk of experiencing things like falls. They're at an increased risk of experiencing depression and social isolation. Now, again, not to say that every single person with low vision is going to experience these, but they're certainly at an increased risk. So before we actually start to talk about some of these low vision conditions, we're just going to take a brief look at the anatomy of the eye, so that when we talk about the conditions, we're familiar with where in the eye some of the problems have occurred. So the first thing to point out here is the retina, which is really the innermost coating of the eye, and that's the part of the eye as well that contains light-sensitive cells and relays information to the visual centers of our brain through the optic nerve located here at the back of the eyeball. Now, the retina is actually supplied by various blood vessels, and in the diabetes lecture, we'll actually see how one of the complications of diabetes can be damage to these blood vessels, resulting in what's referred to as diabetic retinopathy. Okay. Another structure to point out is the macula, which is a yellow pigmented area that's actually near the center of the retina. And the center of the macula is actually referred to as the fovea. And the fovea, the macula, are responsible for our central vision. Okay. Now if we move to the front of the eyeball, the pupil, the iris, is the colored portion of our eye, and it's responsible for really controlling the diameter and the size of the pupil, and thus the amount of light that is reaching the retina at the back of the eye. So the pupil is, of course, the hole that's located at the center of the iris of the eye, and this allows light to move through and reach the retina. The lens is the transparent structure that actually reflects light onto the retina. The cornea is the transparent front part of the eye that covers the iris and the pupil, and also helps to refract light onto the retina together with the lens. Now you'll notice at the top of this diagram, as well as at the bottom of the diagram, there's two muscles, the superior rectus muscle and the inferior rectus muscle, and they help to really control movements of the eye. And so the superior muscle is primarily responsible for elevating the eye. So as you can imagine, as that muscle shortens and contracts, it would actually be pulling the eyeball upward. In contrast, the inferior rectus muscle, when it contracts, it's actually going to pull the eyeball downward. And so it's responsible for depression of the eye. And although it's not illustrated here, there are two other muscles, the medial rectus and the lateral rectus muscles, that are responsible for moving the eyeball both inwards, adduction, as well as outwards, laterally, abduction. And again, they aren't shown, but they are part of how the eyeball actually moves.